Question 45 reads, each of the following is a true statement in this case except one, which is the exception. So here we have a 28-year-old male. The chief complaint is, my girlfriend says my teeth are rotting. His background and patient history is an active cannabis user, and he's accompanied by his brother. He has a blood pressure of 136/86 and a heart rate of 98. He has multiple carious teeth, and while the oral examination was being carried out, the patient smelled of cannabis. So option A reads, features of recent cannabis use include tachycardia, euphoria, and paranoia. So it's known that patients who are high on marijuana could present with euphoria, tachycardia, and hallucinations, paranoia, and a hyperactive state. So these are all signs that would tell you that the patient has used cannabis and you need to consider special treatment modifications. So because this is true, this would make it an incorrect answer for this question. Option B reads, vasoconstrictor should be avoided if cannabis use is suspected. So considering a patient who is high on cannabis has a high heart rate and high anxiety levels, using a vasoconstrictor like epinephrine in local anesthesia would worsen the situation and would be contraindicated. Instead, we want to use a local anesthetic without a vasoconstrictor like mepivine. So this would be incorrect. Option C reads, acute intoxication effects usually subside within 2 to 3 hours. This is true. The acute effects of cannabis intoxication usually go away within 2 to 3 hours, although we usually delay treatment for at least 24 hours just to be safe. So this would be incorrect. Leaving us with option D. Benzodiazepines should be administered to calm down an acutely toxic patient. So because using cannabis depresses the CNS, benzodiazepines like diazepam and lorazepam would only increase the depressant effects on the CNS and thus risk the patient's life. So they're not recommended. In fact, elective dental treatment should be delayed for 24 hours if a patient is using cannabis unless it's an emergency. So because this is a false statement, that would make
Each of the following is a recognized dental specialty of the ADA except for one. Which one is the exception? The ADA recognizes 12 dental specialties, and they are the following. We have dental anesthesiology, dental public health, endodontics, oral and maxillofacial pathology, oral and maxillofacial radiology, oral and maxillofacial surgery, oral medicine, orthodontics, pediatric dentistry, periodontics, and prosthodontics. So as we can see here, oral medicine, orthodontics, and orofacial pain are all listed here as a dental specialty, making these incorrect. So this makes B our correct answer, as implantology is not a recognized dental specialty. So those who can perform implantology are general dentists who have received required additional education to place implants, but for more complex cases, the specialties that are better suited to treat these patients are dentists in periodontics, as well as oral and maxillofacial surgery. But implantology is not the only dental field that isn't recognized by the ADA. We also have cosmetic dentistry, geriatric dentistry, restorative dentistry, forensic dentistry, and special care dentistry. Which of the following best represents the mechanism of fluoride? Fluoride provides protection of enamel from demineralization and increases the resistance to acid attacks, so we want to figure out how it does so. Hydroxyapatite is the main component of enamel, but when bacteria consume carbohydrates in the oral cavity, the acid that is produced as a byproduct causes dissolution of the hydroxyapatite, and the pH that this occurs at is around 5.5. Once this occurs, it sets the stage for caries formation. However, if fluoride is present, it'll replace the hydroxyl group in the hydroxyapatite to form what is known as fluoroapatite, and this has a much lower critical pH or pH needed in order to cause caries formation, so this occurs at 4.5. The fluoroapatite is able to increase the attraction of calcium and phosphate to the tooth surface and decrease the solubility of enamel. That being said, we can take a look at our answers to see which one is correct. Option A reads decrease the dissolution of calcium phosphate, and this is our correct answer, as the formation of fluoroapatite will increase the strength of the enamel by lowering the critical pH for dissolution to occur. This means that at the same pH of 5.5, which is the critical pH for hydroxyapatite, fluoroapatite will not be affected and can maintain calcium and phosphate ions and prevent dissolution of these into the saliva. So we'll just take a look at our other answers to see why they're incorrect. Option B reads increased dissolution of calcium phosphate, and we know that this answer is incorrect, as fluoroapatite would form a stronger structure and is soluble at a much lower pH. Option C reads decreased availability of hydroxyapatite, and this answer is also incorrect. While fluoride ions do combine with calcium phosphate to form fluoroapatite, this does not mean that hydroxyapatite is limited in availability, and the decrease in availability of hydroxyapatite is not the mechanism by which fluoride strengthens enamel. Option D reads increased hydroxyl content within enamel, and this answer is also incorrect. As we know, the hydroxyl group of the hydroxyapatite is replaced by fluoride, so the hydroxyl groups are not increased. Each of the following is an advantage of glass ionomer-based dental sealants over resin-based dental sealants except one. Which one is the exception? Taking a look at our answers, option A reads less shrinkage on setting, and this answer is incorrect, as this is an advantage of GI sealants over resin-based sealants. Less shrinkage means that there is a less chance of marginal leakage and secondary caries, and also implies a lower chance of failure of the sealant. Moving on to option B, it reads high fluoride release, and this answer is also incorrect, as this is also an advantage of the GI sealants. High fluoride release is something that is beneficial and is a characteristic trait of GI-based sealants. It works continuously to provide the tooth with a source of fluoride, and this is what is able to help with the remineralization of enamel to reduce caries risk. This is extremely beneficial in sealants, as the purpose is to reduce caries risk or progression. It is also used in root caries, as the cementum is more susceptible to decay. Option D reads low thermal expansion, and this answer is also incorrect, as this is an advantage of glass ionomer compared to dental sealants. A low thermal expansion, or one that is similar to those of dental hard tissues, is beneficial, as it helps the material adapt to the tooth and prevent failure of the sealant at the margins. Option C reads low susceptibility to desiccation, and this is our correct answer, as this is not an advantage of dental glass ionomer-based sealants. Instead, this is an advantage of resin-based dental sealants. Glass ionomers undergo an acid-base reaction to fully set and can form a chemical bond with the tooth surface. However, they are prone to desiccation while setting, and this can affect the deterioration of the restoration. On the other hand, resin-based sealants are superior because they experience less desiccation and water loss. So in addition to the low susceptibility to desiccation, resin-based sealants also have a few other advantages. They are wear resistant and they are stronger than GI-based sealants. With GI-based sealants, we do have the 3 advantages that are listed here, but we also have a few more advantages. They can directly bond to hard tissues, and they also have hydrophilic properties, which means that they don't require as much moisture isolation as resin-based sealants do.
Question 31 reads, when is the most appropriate time for non-urgent dental treatment of a patient on hemodialysis? Hemodialysis is a treatment for kidney failure. Here, a machine filters waste and water from your blood. It helps control blood pressure and balances important minerals. It's usually performed 3 days a week. So, option B reads, dental treatment is contraindicated during hemodialysis. Patients who have advanced kidney disease and are undergoing hemodialysis do require special considerations. However, they are not contraindicated for non-urgent dental treatment. So they can have non-urgent dental treatment, but with special modifications or considerations. So this is incorrect. Option C reads 2 hours after hemodialysis. Patients who go through hemodialysis must wait at least 6 hours after dialysis to receive dental treatment. So not 2 hours. So this would be incorrect. Option D reads, early morning appointment on the day of hemodialysis. Any form of dental treatment, urgent or non-urgent, should be avoided on the day of hemodialysis to prevent excess bleeding. So this would be incorrect. And it leaves us with option A, following day of hemodialysis. It's important to consult the patient's primary health caregiver or nephrologist to determine ideal timing for dental treatment. However, the accepted rule is that non-urgent dental treatment should be performed on non-dialysis days, and you must wait at least 6 hours post-dialysis to provide dental treatment. So the following day is the most appropriate time, making this the correct answer for this question. So question 18 asks, after achieving anesthesia using 2% lidocaine with 1 to 100,000 epinephrine, blood pressure is taken and reads 170/90. What action should be performed by the dentist? So what we know is that normal blood pressure for the average adult is 120/80. A reading higher may indicate hypertension, which is a chronic condition where a patient's blood pressure in the blood vessels is constantly elevated. It is important because it is a risk factor for stroke and heart disease. However, sometimes hypertension can be acute. This means it happens due to a certain stimuli like pain or anxiety. The blood pressure will eventually go down and go back to normal, so because of this phenomenon, it's important that we repeat the blood pressure measurement. So looking at our options, option A reads no modification needed. The patient's reading is 170/90, which is over the safe reading of 160/100, meaning we would not be able to work unless a different second reading tells us otherwise. So this would be incorrect. Option B is refer the patient to their primary care physician. So patients are referred to their physician if a second reading confirms a blood pressure of over 160/100. Here, the patient's blood pressure was only taken once, so we can't make that call just yet, so this would be incorrect. Next is option C, reschedule treatment after 14 days. We want to ensure that the patient is keeping their blood pressure under control, so just sending them back home isn't a very efficient way of controlling their high blood pressure, so this would be incorrect. Lastly is option D, repeat measurement after 5 minutes. Again, standard protocol is to repeat a blood pressure reading if it is high the first time to confirm it. So if we find a second reading that is lower, we can assume that it was acute hypertension and continue elective work. Whereas if it is another high reading, we assume chronic hypertension and refer them to their primary care physician. So that would make option D correct.